For a clinician, how much of their time do you think is trying to find the information you need versus actually caring for a patient? When you're coordinating care, it means you need to pull together different healthcare providers, health systems, insights from carers, information from different consults and investigations, to serve all that information up for a clinician when they need it to deliver quality patient care. In this episode today, I chat with Leanne Anderson from Data Capture Experts. And in this episode, we talk about the importance of capturing the right information up front when looking after a patient, finding the right balance for a vendor when creating custom-built solutions, what the next generation of EMRs might look like, and a lot more too. Collaboration starts with a conversation, Team Health Tech. Let's make it happen. This is Talking Health Tech with me, Peter Birch, featuring content and community about technology in healthcare. So hey Leanne, how are you?
I'm really great, Pete. How are you?
Thanks for joining me in, I was going to say your hometown. It's kind of closer to where you are, at least here in Melbourne. But for those that don't know you, tell us about Leanne.
Well, Leanne began her career as a medical scientist. So I worked in pathology labs for first 13 or 14 years of my working career, and mostly through regional Victoria. So lots of small regional and rural hospitals. And sort of once I got to a management stage there, I decided I'd have a go at working in public health. And so I jumped over to Bendigo Health, and I was just going to go there for 6 months to do a project. And I stayed for 13 years.
So usually it's a 2-week job or a 6-week job. Okay, yeah, it's 6 months, but 13 years. Wow.
Yes.
That
Yeah.
would have given you a good exposure to healthcare in rural Victoria, no doubt.
Absolutely. So a lot of that time was spent working on projects, lots of service development projects and more operational projects. And then I eventually moved into a role as the director of the cancer centre there. So for 4 years, managed the cancer service. And it was at the time that we were ready to move into our new hospital. So it was sort of grabbing 6 sort of completely disparate units that worked across Bendigo Health and pulling them in together to become the cancer centre and work together as a team. So that was a big piece of work, but lots of fun and really good people to work with. But so I did that for 4 years, and then I moved into a clinical transformation role, and then COVID hit. So then, like everybody, we did lots of COVID stuff. So I actually started up the contact tracing unit for the Loddon Mallee region under the public health umbrella back in 2020 when that second wave was in its crazy stage. So again, then lots more about working with the department after that, because that was sort of, we had to work quite closely with them and with the other regions. So it was a fun time. And then almost a year ago now, I decided to jump out of public health and go and work with a vendor. So I now work with Data Capture Experts as an account manager, account director type role. And so bringing all of that experience I've had in health and in hospital systems and using lots of systems over all those years as well, and bringing that to a software company to help inform that platform, but also then to work with our customers on the best way to deploy the program into their health settings and how to use it well.
Yeah. I mean, that's so cool, making that jump from public health into a software company or technology company in healthcare. How do you make that leap? I mean, that transition, is it something you always wanted to do? It's not like all the best things come out of nowhere, right?
Exactly. And not something I'd ever dreamt I would do. Never thought about it. Would never have thought I'd work in IT in general. And so it was a big leap. But whilst I was in the cancer centre and then doing projects over the years, a lot of them had something to do with the system that we were using. So it was all about the process. The process led to the platform that we had to use and where it caused problems or where it helped us. And so sometimes it was a good thing and sometimes it was a really bad thing. Sometimes the system was the barrier. So all that sort of led to me doing the CHIA qualification. So I did through the AIDH, the CHIA certification. So, and that was fascinating. I loved it. It was one of the hardest things I've ever done, mind you. It's really difficult.
A lot of reading.
It is a lot of reading, but I really loved it. And that, I guess, sparked a bit more of an interest to learn more about that space. And so when this opportunity came up, I thought, well, let's give it a go.
Yeah, love it. And so with Data Capture Experts, right? Tell us about Data Capture Experts.
Yeah, so DCE have been operating out of Melbourne for about 11 years now, and we have a care coordination platform. So it's a platform that can be used in community health, in mental health, in acute hospitals, sort of right across the board, really, and specialist clinics and those sorts of areas as well. It works quite well in. So it's a system that's been built by someone in technology by learning from clinicians. So he's really spent a lot of time with clinicians and with different clinical groups to learn about health and then applied his technological background to that rather than doing it the other way around, I think.
There are a lot of technology solutions looking for a problem to solve, which is probably not it's a bit of an upside down way to go
Yeah.
about it, but it's good to understand what clinicians need and then build for it.
Yeah,
Mm.
exactly. And build as, I guess, as generically as you can so that it's the reference data that drives things rather than have things so totally hard coded that you can't change them. And so it can be quite nimble and flexible. And when we work with a new client, we can be quite agile in the way that we build their workflows so that actually works for them. The goal's always got to be make it good, make it easy for the clinicians to provide care. So you got to make sure that you can build your platform in a way that you can actually get the workflows that the clinicians need.
And for those that might not be totally across how the plumbing, the technology plumbing works within a hospital setting, like everyone will know about an EMR that exists, but is this an EMR? Does it work in conjunction with that? Is it something else? Where does it fit within that kind of stack of stuff that people use within a hospital setting?
Yeah, exactly. And it's hard to describe
Yeah.
actually. So what typically an EMR and the EMRs that I've used in my career collect lots of data and you plug lots of information into them, but they're sort of pretty static the way that they work. So what we have built is what we call it care coordination because it's just a bit more than an EMR. I'm starting to call it the next generation of EMRs because we need to move on past the static data collection. And so it works in a way that you determine the funding and the reporting requirements of a patient at the very beginning. So when a referral comes in, you know then, and the admin staff all know at that point in time what sort of funding model and what reporting is going to be required. And so if you bring the referral in at that point and then work through the care plan, and the care plan, might be 6 appointments with this practitioner and 2 appointments with that one and 3 assessments at different time intervals. You know what the plan is, and the clinicians know what their plan is because they treat those patients all the time. So then if you build the data that is needed to work into the workflow as you go. So you start at the referral, you do your assessments, you do your care plans, you schedule all of those care plans, but along the way, the data that's collected is the data that's needed at the very end for the billing and the reporting. So you don't have someone having to go back and count the number of appointments or count make sure that the data's been entered into all the fields or go and collect it through the clinical notes that are possibly handwritten somewhere or free texted somewhere. So if you collect those data points all along the way, when you get to the end, not only have you provided the care, but you've also picked up all the information you need to do your billing accurately and all of the reporting, especially in the public sector where the statutory reporting workload is massive.
Yeah. I always like to try and understand, like, if not for the solution, then what would that process look like? So I think you've already described some of that there. It's that really at that end point, all that cleaning up and the important reporting requirements, billing it, and then the getting paid part that sounds like there could be a lot of leakage or a lot of inaccuracies, and getting it up front and then along the way in all the one spot kind of makes a lot of sense.
Yeah, and just try and make it easier to do that. So you don't want clinicians to have to go back through their notes to find the bits of information they need. That's not good use of their time at all. But you also don't want to have admin staff having to go back through and trawl through notes to try to work stuff out either, because that's when you can get errors. But also it's just a time waste. And we're all short on time in health now, whether you're in the public or the private or not-for-profit sector. There's no resources around to spare. So you need to be efficient. And so the best way to be efficient is to just collect the right data at the right time, right the way through. And then it's all there at the end when you need it.
Yeah.
You don't have to spend time on that.
Is that what then when you talk about digital care coordination, this is what we're talking about here?
Yeah.
Yeah.
Yeah. So that the digital system should do some of the work for you. And if you tell it that I've got this referral for this patient under this funding model, then it then knows which pieces of data to collect along the way and what that should look like.
Yep.
So then the reporting will just be automated at the end.
Got a good feel for what it's like on the front line too recently because you were chairing a session at our spring summit recently, and that was a good dive into digital care coordination. Talk to us a bit about that session that you chaired and maybe some of the things you took out of it as well.
Yes, that was fun. Got to chair a session with three fabulous professionals from the Loddon Valley region. I happen to know each of the three of them already as well, so it was nice to be able to do that as a group together. I've worked with a couple of them before, and we talked about the deployment of their community platform across the Loddon Valley region. So Loddon Valley have been very clever and very strategic in that they've formulated a system of architecture across their region, so they could deploy one system to 16 different sites and use it for whatever programs they needed. So because we were deploying it across such a wide variety, we needed to make sure that that same system could work for specialist clinics, for community health, for community nursing, for district nursing, for mental health programs. So but it's got to be the same platform that can manage all of those different funding types, reporting types, scheduling types, different clinicians. So the work they've done up there is really quite fabulous, and they're now using this system across a number of sites. But really, what it's done for them is meant that they can share some of that knowledge. And so they're not all having to learn how to use the system on their own. They're able to leverage from each other. And, they all have connections between all those health services. So they're able to leverage a lot of that knowledge and work together. But also we were able to work very rapidly with them through COVID. So when they needed a COVID positive pathways system to manage all of those COVID patients, we worked with them, 2 weeks turnaround to start up a new module to deploy it, and rolled it out across 16 sites in something like 25 days.
Yeah,
And
wow.
then just more recently, during the floods in Victoria, we also had a call from them on a Friday evening saying, we've got this problem across the region. All these people are displaced without healthcare, without access to their medications or the normal services that they would access. Can you build us a module so that we can monitor and manage and assess these people as they're coming into evacuation centres and see what they need, and then what they would do is connect them with the local care facilities that were available, and make that local knowledge was needed. So 5 days later, we deployed an entirely new module for them to do disaster management, and we made it fairly generic so that it could be used for any disaster. So if there's bushfires in the future, they could use the same module again. So again, it's about working with the users and finding out what it is they need and how they need to work to be able to build something that is really useful to them.
I was going to say, because, if you're a tool that does something specific, like an appointment booking solution, or like it books appointments, or a Medicare billing tool, but like, and not, to oversimplify some of those tools, but that's what you plug it in and that's what it does. When you're a solution that is, I guess, somewhat flexible and is, I guess, in a way tailored towards particular solutions and evolves with clinicians and is based on feedback, it's good in the sense that it can be flexible, but at the same time, from your perspective, to be able to explain that, but also to then implement it, it's difficult. So how do you find that balance between, having a solution that is built for purpose while at the same time is then usable and applicable to other health services as well?
Yeah, it's a real balance to get that right. But because our platform's been the architecture of it overall has been really smart.
Yeah.
The way that they've sort of worked it out in the very, very beginning. And I'm not technical, so I can't explain that bit.
It just works, right?
It works. It works like a bit of magic.
Yeah.
But
That's how it should go.
because exactly,
Yeah.
that's what I think.
Yeah.
So because of that magic that sits in underneath it all, it actually can be adapted pretty quickly and easily, and that's one of the really key features to it. And I think that's what's needed in health, because health isn't static; it doesn't stay the same.
Yeah.
And the only thing we know about it is it's always going to change, and those services are always going to have new requirements. So being sort of agile and nimble in the way that you build things so that you can adapt it is really key. But it is a balance between being able to provide, a system that works beautifully for community nursing programs, but also needs to work beautifully for a mental health service and, a nursing program of work or an allied health service or something or other. So, but again, it's just in the way that it's built that's able to do that.
Is there a particular area that you really dive into or where it really shines? You mentioned community nursing. You've come off the back of doing COVID or disaster recovery. Is there a particular kind of slot that you really kind of fit in and say, this is, if you're doing this in your health region, you really need to be thinking about getting in touch?
Yeah, look, I think if anything in mental health and those community health services
Mm.
is really where the product shines. We do have instances of it in acute health settings and can do that as well. But really, that anywhere where you've got long-term care is probably where the product is really worthwhile, because it can help you sort out the requirements of that patient over time and make sure, and where that's multidisciplinary as well. So where you need lots of different inputs from different clinicians or different services into a patient's care, and you don't want to repeat stuff. So, if you've done this, the functional assessment once, you don't need to do it 3 times by 3 different clinicians, which is what happens
Sure.
often otherwise. So you do things once and use it again. So if you've got a patient that's got any kind of long-term care plan, that that's more than just a transactional 1-day appointment, then that's where it's really nice, because you can see the patient came in with a certain problem and you work out what the goal is to get them to where they need to be. What do they need? What services are needed to get to that goal? And then you build that as a care plan. And that care plan could go for a month, or it could go for 10 months. But you're able to monitor the entire plan from one screen and from one system.
And I remember at the Spring Summit, we were talking just before we started recording as well. There was a lot of good engagement in the chat. And one of those questions that came up from one of the attendees was how, the solution connects in with the rest of the ecosystem as well. So have you got that in mind as well? Because we don't want all these silos of information being created within health settings, right?
That's right. You can have the best system in the world, but if it's only in one health setting, it really isn't useful to the rest of the health service at all. And that's the problem that we've got, in Australia in general. But so, we do as much as we can. And so one of the first things we did was make sure that we can upload our documents to My Health Record. So all our discharge summaries and other documents automatically go to My Health Record. But the other key piece of it is to make sure that in whatever way you are building your system, you use it, interoperability standards. So if you build your product in a standards-based fashion, then when there is something to connect to one day, we'll just be able to plug it in.
Yeah.
Again, bit of technical magic there,
Sure.
but
I'm sure
it
it's
should just
that
plug
easy
in.
too. Yeah.
Exactly. But it's able to be done. And I guess
Yes.
if you don't build
Yes.
it with that capability, then you're always going to be behind the 8 ball.
Absolutely. No, that's really important. And so then future facing, moving into 2023, those observant few who are watching the video will realize it's Christmas when they see your earrings. But the looking into the new year, coming off the back of, some of those, the disaster recovery, obviously the pandemic as well, what's on the horizon for DCE? What's going to be on your radar?
Yeah, so we've got a few exciting projects going live early in the new year, or late in December, and then early in the next year. So one of our fertility customers, Virtus Fertility, their system will be going live December, January. So that will be exciting to watch. We've just picked up a new project. We're starting to work with a hospital in Papua New Guinea.
Cool.
So also very exciting project to be working on. We'll be looking next year to go more into the mental health space. We've got one large deployment of a mental health system at the moment, another one about to go live. So we'll be looking for more customers in that area. We think that's an area that we can really make a difference in. And otherwise, I think 2023 is going to be about virtual care. I think everybody's looking for that virtual care solution, and we have this in our existing system. We have a great observations module, and we are working with the Lodd and Mallee, in fact, on what virtual care would look like for their region, and connecting up to wearables and those sorts of things, so we can get some automated observations coming into the system. So we're looking forward to that project. I think that will also be a lot of fun.
They're good priorities for the future too. So there's going to be a lot on the plate. They're looking forward to hearing about it, of course, with DCE as THT Plus members. Looking forward to continue that conversation throughout the community and no doubt at summits and things too. So Leanne, thanks for coming in, having a chat, and let's do it again soon.
You're very welcome, Pete. It's been great to be here.
For more content and community about technology and healthcare, visit talkinghealthtech.com.